A BBC investigation has been told that the poor level of health care provided to people in police custody has harmed patients and led to preventable deaths. Currently, most healthcare provided to people in custody in England and Wales is provided by private companies. But doctors say that the level of care being offered is a scandal and is letting down the most vulnerable people in society. The journalist Faye Kirkland, who also worked as a GP, has this special report.
Just some of the faces of people who've died after being in police custody. The healthcare they received criticised at their inquests. Darren Lyons was 43 with mental health issues. He died in hospital after having a cardiac arrest in police custody. A jury found that nurses supplied by a private company had failed to properly assess him.
We're always with animals, and that's a picture of when he got his degree.
Diane Darren's mum feels the healthcare offered to him in police custody failed him.
It was clear in the court that nobody did anything for him. No one. Everybody failed him.
Before being taken to hospital, Darren was treated for 7 hours.
He was then left for another period of time before eventually he was in such a bad state of health that he had to be taken to hospital and he couldn't recover from that. This death could have been prevented had he been assessed properly at all levels.
The company who provided the nurses told the BBC that the jury had found failings with the care, but disputed that this contributed to or caused Darren's death. Doctors who've worked for some of these private companies told the BBC that their employers are putting profit before the safety of their patients.
The private providers are using the cheapest options possible. Newly qualified nurses and newly qualified paramedics and doctors who don't have the experience or training. I've also seen serious medical problems such as skull fractures and pancreatitis because the staff are not qualified enough to pick them up.
It used to be quite intense, the initial training for doctors to take on this sort of work, but now it's a 2 or 3 day course, and then the nurse or the paramedic is let loose to assess detainees on their own.
These concerns are similar to those in a report seen by the BBC, which was sent to the Home Office and the Department of Health 2 years ago. It lists concerns from other healthcare professionals, staff shortages, innumerable circumstances where patients were put at risk, and in one instance describes how a child, who was 12, was left without medication for more than a day. Currently, the commissioning of healthcare is undertaken by police and crime commissioners. However, that responsibility was planned to move to the NHS.
It would be like, going to hospital and having an operation done by somebody who wasn't trained properly to do it. That's the kind of level of scandal this actually is.
The Faculty of Forensic and Legal Medicine, which sets the standards for healthcare in police custody, was one of the bodies which recommended that transfer.
The one move that would have made a huge difference to this, which would be to put healthcare into the NHS, so you would have an equivalence of care in police custody that you would, say, in a hospital or in a general practice, didn't happen because the then Home Secretary, Theresa May, for reasons we just don't understand, decided to cancel that.
Theresa May commissioned an independent review which is yet to be published. We've been told that key evidence given to this review again suggests that commissioning of care should be within the NHS. We've been told the Home Office has had this review since January, but has not yet acted on its recommendations. Since then, people continue to die in police custody, and investigations are being carried out into the healthcare they received. More than 160 people have died in police custody in the last decade. The worry is that without greater oversight of healthcare, more people could lose their lives. Faye Kirkland, BBC News.